Hi guys, Professor Hussein here, and in this video I just want to kind of give you guys a general idea of what a healthcare administrator actually does. Okay, because I know it might be a funny question or a funny topic because you're all, if you're not in public health, you're at least in health administration or public administration or something like that. So you probably have an idea of what you can expect as a career. I hope you do, or you would think, but I think some of you guys just sort of picked it. Okay, maybe someone told you to, someone said it would be a really great idea, or maybe you just needed something to pick and you thought, well, healthcare, I don't want to be a physician, or a nurse, but I want to work in healthcare. Why not health administration? That's kind of, I don't want to say that's how I got into this, but it's kind of the mentality that I had, because I originally actually majored in biology, and then I just kind of went into the business side from there. But I do want to actually go ahead and go through some of the just typical tasks that you would most likely be responsible for as a health administrator. Now, these are just very general tasks. There are many different things that a health administrator would do. And it kind of is going to depend on the type of facility, the organization, the specific job title, things like that, the level of responsibility you have. But, these are just typical things you can probably expect just at least a few of these things that you would be responsible for if you get a job as a health administrator. Okay, so first of all, you would be expected to conduct market market analysis to understand the growth of your business, or the business you work for, and the revenue drivers and the motivations of the business. Okay, you would also have to manage the financial operations of that business, or you would probably have to manage financial operations of that business. To what scale, it may be dependent on your actual level or your job title, okay, and the level of responsibility that they give you. So this can include, this would be like daily and annual reporting, okay? Then a third thing that you might have to do would be to lead clinical and business professionals, okay? Meaning you would be managing possibly nurses, physicians, and other, business professionals, other technicians, or whoever, is working in your office or your department. So you would be managing them, okay? Or leading them is probably a better word to say. And this would include trying to explain the needs of the business to them, helping to improve maybe their performance on the job. You would also try to find ways to help improve like the clinical quality of your organization, and overall you want to increase the growth, right? So you would be leading whoever is working in your office or your department in that way. Okay, and then the fourth thing that you might be doing is overseeing staffing. Okay, so this would include hiring, training, recruiting first, then selecting and hiring, training, evaluating their job performance, providing them with reviews, and ways that you can further on their training and help them become more high-performing employees. This is actually an HR task, but typically these days HR, the veil between HR and management it's going away, okay? It's dissolving. Many HR tasks very specific HR tasks are being outsourced, to maybe freelancers or even HR companies, and a lot of just typical human resource management is being given to the line managers. So as a manager or an administrator, you would be dealing with a lot of the selecting, hiring, things like that. And then a fifth thing that you might have to work on as a health administrator would be to prepare the healthcare facility for quality and accreditation visits, okay? Sometimes the health department is gonna check up on you. Sometimes you're gonna get a peer review organization, maybe an agent is gonna come and check up on your Medicare cases. And sometimes it's the fire department, sometimes it's any kind of governmental agency, or not even that, it could just be your accreditation, okay? So to check up on the quality that you're providing to your patients, and all the safety, patient safety, and everything like that going on in your organization. So you're going to have to work in accordance with the government, with insurance expectations, and things like that. So you're gonna have to know exactly what the expectations are, and you're always gonna have to be vigilant and know exactly what is going on in the organization so that you can make sure everything is always up to par, always up to quality, okay? And you're gonna have to be the one, when those agents come and when those inspections happen, you're gonna guide the process, okay? So then the sixth thing that you might be doing would be educating staff, okay, on government guidelines and things like that, okay? And this is crazy stressful. It seems like it's very, it should be easy. You just memorize some rules and tell everyone about it. No, because the government, and also not even just the government, but policies, even private sector policies, they are always going to be changing. The healthcare environment, or the healthcare industry, is it's different from any other industry out there because it's always changing, okay? They're always coming up with new policies, doing different things, new changes. They might be minuscule changes, they might be huge changes, and you have to keep up with those changes, okay? And every time something new happens, you have to make sure that everyone knows about it, and it's your responsibility to make sure they don't know about it, okay? And since the changes are just all the time, it's almost like trying to hit a moving target, okay? Because you almost never catch it in time, or right away. So you always have to keep an eye on everything going on, all the changes happening in policy and whatnot, and keep up with that and make sure everyone knows about it so your organization does not get in trouble, okay? Next, probably the last thing, or the last biggest task you would be having to do if you are a healthcare administrator, would be managing human resources. And this is huge. This covers so many things, but really you're managing the people that work there, okay? So this is where, and it's gonna be different from other organizations, other industries out there, because healthcare as a healthcare administrator, when you manage resources, you're managing highly educated, licensed professionals. So not only are you going to, okay, yes, you're managing them, but you have to make sure that their licenses are current. You have to be checking up on that, and then you're going to be helping them renew their licenses or their certifications, and also continuously doing background checks and helping them with their additional training that they have to get done to keep their licenses and things like that, okay? And that also can be tricky because, like I said, you're working with highly educated, licensed professionals, okay? You're working with physicians and nurses and people who have PhDs, and not very many people want to be managed. These are the type of professionals that don't want to be managed. So the way that you conduct yourself and communicate and assist these professionals is an art form in itself, okay? So just letting you guys know that is something you're gonna have to develop if you, as you work your way through becoming a health administrator. And also, okay, so let's just run through a couple places where you might get a job. Okay, so you could be working in hospitals, and most healthcare professionals work in hospitals. I believe 40% or roughly 40-ish% of healthcare professionals will be working in hospitals. That includes you guys, okay? But also that is not the only place where you can find a job, so don't think you are limited to the hospital. There are so many other places. And another huge one, and it will be growing in the near future, are the long-term care facilities, okay? That's a huge one as well. Okay, then there are other medical practices. Now these medical practices and outpatient centers that you could get jobs with, they might be small, as in they might just have one physician, you know, and maybe one nurse or so and some CNAs working in that building, and that's all you're gonna be really managing. Or it could be a huge facility, okay, a multi-specialty practice that you're dealing with and you're working with. So it could be small, could be huge, right? And you could also do consulting, okay, business consulting in healthcare. That's huge. You could also be working for the government, okay, in the health department. Then you could be working in health insurance companies. Of course, there's the administrative side and the business side of health insurance companies, but there are also departments in these health insurance companies where they have to deal with like malpractice suits and whatnot. And it's really great to get someone who is a health administrator and who has experience working in a health facility, because they understand the operations of a health facility, so they can provide a lot of expertise in that area. And also, you could be working for pharmaceutical companies. You could be working in sales. You could just be working as an administrator. So many things, okay? There's also research and development as well. Yes, and there is also academia, duh. So I hope that helps and gives you a really good idea of what you could be looking at in the future. I hope this clears things up a little bit about, you know, for those of you who kind of just picked it and didn't really know what you're getting yourself into. And I will see you guys later.